everybody, I am Reese the Bomb Diggity, and today we're back with some more
Welcome
surgery.
to Surgery Squad's virtual root canal procedure.
Okay.
I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today. A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection.
The nerve and blood supply.
Our patient today is having a root canal performed on their lower right second premolar.
Check out my other video. The
A
other
dental
patient
professional
was
may
also
refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
No, thank you.
No problem. Let's move on.
Misconceptions.
In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause.
His tongue.
Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
It's gonna be bad. I already know this. It's his tongue.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
5 minutes later? If I could move my mouth, that would be great, because I don't know if I could breathe through my mouth. No, I probably can't if I was stupid.
Now that the patient's mouth is numb, we can move on to isolating the tooth.
Let's do
Since
this.
our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Day Wanda. Right here?
Once the rubber dam is in place, put on a tooth clamp to keep it from moving. Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
We're gonna dry this out? Oh, we're gonna...
So far, so good.
Yep.
Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
Cute!
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
Oh. I'm scared. No, I thought that scared me.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Looks like pee and it
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
3 minutes and 54 seconds
Great.
of this.
Now use the suction to remove the bleach from the patient's tooth.
What?
Next, we'll need to fill the tooth using a rubber compound known as Gutta Percha. Gutta Percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the Gutta Percha cone.
Cool.
Let's see. Looking good. A heated instrument is now used to remove the excess Gutta Percha.
What's this for? Wait.
Pack the Gutta Percha into the tooth canal using a plugger.
Disgusting. It's not disgusting.
After the Gutta Percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off.
Okay.
Once the dentist verifies that the canal has been sealed, a filling or crown is placed depending on the location of the
dental
tooth.
surgeon. If you haven't
You
checked
can
that out,
learn more
check that
about
out.
fillings and crowns in our virtual dental filling and virtual dental crown procedures here on surgerysquad.com.
Okay, no need to promote your games.
After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to greatly reduce the need for a root canal. And that's a root canal. Why not check out some of our other amazing surgeries here on surgerysquad.com.
Okay. Whew. That was something. These other surgeries. Victoral Campania and carpal tunnel. That's about it. Go subscribe. Check out my Vine, Instagram, and I'll see y'all later.